share the message of love. I go to share the blessed hope. But if I get discouraged, I call to Jesus' help, because I have decided I will go.
It may not be on the mountainside or over the stormy sea. It may not be at the battle's front. My Lord will have need of me. But if by a still small voice He calls to paths I do not know, I'll answer, dear Lord, with my hand in Thine. I'll go where You want me to go. I'll go where You want me to go, dear Lord, or mountain or plain or sea. I'll say what You want me to say, dear Lord. I'll be what You want me to be. Perhaps today there are loving words which Jesus would have me speak. There may be now in the paths of sin some wanderer whom I should seek. O Savior, if Thou wilt be my guide, though dark and rugged the way, my voice shall echo the message sweet. I'll say what You want me to say. I'll go where You want me to go, dear Lord, or mountain or plain or sea. I'll say what You want me to say, dear Lord. I'll be what You want me to be. There should be somewhere a lowly place in earth's darkest field so wide, where I may labor through life's short day for Jesus the crucified. So trusting my all unto Thy care, I know Thou lovest me. I'll do Thy will with a heart sincere. I'll be what You want me to be. I'll go where You want me to go, dear Lord, or mountain or plain or sea. I'll say what You want me to say, dear Lord. I'll be what You want me to be.
Good morning, brethren. My name is Marta Shamena from South Namibia Conference in Windhoek in Namibia. I just want to say to welcome you to this morning's health talks. I welcome all of you from North Namibia Conference, from South Africa, from Zim, and from all platforms. You are welcome. This morning, my topic is on diabetes. But before I start with diabetes, I just want to say a few things about Corona. We have been speaking about Corona for, quite, many times on Adventist World Radio and so on. And of course, many other topics on health, on Adventist World Radio. We also shared some time on the national TV, NBC. But today, I'm just going to highlight a few things. The fact that the lockdowns have been released does not guarantee that Corona is over. Corona is actually far from over. And so far, we have lost about 4.8 million lives worldwide and 3,500,000 Namibian lives. So it is really far from over. It might be a little bit slow now because we are entering the summer months and so on. But we really are still in the pandemic. And so I just want to encourage all of us to still continue to adhere to the measurements, to the preventative measurements that have been put in place, that we know very well. The wearing of masks. I want to speak a little bit on these masks. They should be used once, like how we have been shown on TV. You shouldn't be using the same mask over and over again. Use it once. If you have a washable one, have a pair of them and wash those ones, wash the one that you use for that day and dry it in the sun. The washing of hands and sanitizing also cannot be overemphasized. Very important. The social distancing is also another very important aspect. When we are gathered in our churches, even though we are just 150, we should make sure that we have optimum ventilation. The doors and windows must be open so that air can circulate. Corona has brought a lot of confusion, just like any other new pandemics, and especially a pandemic of its global magnitude. People are really confused, and so they are looking for information from here and there. I advise that you should be very selective with the information you get on social media and elsewhere. You should listen to your, more reliable resources, and of course, where you are not so sure, you've got health professionals in your midst. Do ask questions. I would say that you should really be very discreet with social media. In Namibia, we have lost lives because of some of the informations that were shared on social media. people went ahead and used some of those remedies that were said to be used and probably overused them, and they lost their lives in the process. So I really want to caution you on this. Another confusion is on vaccines. Vaccines, we have known them for quite some time now, many years now. And what happens with the vaccine, as we have emphasized previously on different platforms, is that you get an inactivated virus that is introduced into your body. And by doing so, it prickles your immune system to produce antibodies or soldiers, if you want to say so, that will fight that particular disease. Or perhaps an ARN, also that is similar to that of that virus, with the same purpose, to fight the disease. A lot of things are going on about vaccines and so on. It is still a choice. I'm not here to say get vaccinated, but I'm here to encourage you to say vaccines have protected people in the past. We had a lot of some other outbreaks like poliomyelitis. We had, outbreaks of measles and mumps and so on, and tetanus and so on. But vaccines have truly saved lives in that respect. So I am just cautioning or maybe advising you that you should make a good choice. Make a good choice, pray over it and make a good choice. I'm not saying go get vaccinated, but I just say do the right thing and make a good choice to be protected. Rumors about 666 that have, or microchips that have been put in the vaccines, those are rumors, and I think you should just do the right thing. Okay. Be assured also that God is still in control. He is still in control. Trust your superiors. Trust the communication channels that you have in place. We have the Adventist World Radio, and probably also some platforms of brethren, Seventh-day, brethren from, different parts of the world. I think trust those and do the right thing. I don't know why we have a tendency of shying away from using our own things. It was mentioned yesterday also with the schools and so on. We have our own communication channels like the Adventist World Radio, and possibly only a few people are listening to it. And you are losing out because we've been really sharing during the lockdown a lot of things during this time. Mental health and celebrations and Corona and a lot more things. So you're losing out, and learn to use the things that belong to your organization, that belong to your church. You have schools, you have even clinics, dental clinic. Instead of you to go and clean your teeth somewhere else, go and clean your teeth at your dental clinic, or go send your little children to your schools. Listen to your channel, the Namibian branch of the Adventist World Radio. Those are very important things. Then you'll not be left out. So I just want to encourage you this morning that we should take very good care. Corona is still far from over. Now, as I said in the beginning, I'm actually going to speak about diabetes this morning. And I chose to do so because diabetes is actually one of the most important health problems in the world today. It's on the escalate. It's one among the few diseases that are really, escalating. You've got diabetes, you've got cancer, you have mental problems, and so that's why I really decided that let me share with you this morning on diabetes. So I just want to also, you as I go through this presentation to see the magnitude and how fast this the disease is really affecting the world. In 1985, 30 million people were diagnosed with diabetes in the entire world. In 2000, it had reached 446 millions. That is now 3.8% of the world population. 6 to 8% of these countries are the ones that with a Western lifestyle. For example, in Europe, North America, and Latin America. And Mexico rated with the highest rates of diabetes in the world. It is estimated that it will reach or even surpass 380 millions in the year 2025. That is 4 years by now. And the greatest relative increase will be produced in the Near East and in Sub-Saharan Africa, where we are right now. And this is why this prompted me to really share with you. And of course, I'm in India as well. The irony of this situation is the fact that half of those people that are affected with this disease are not aware of their situation because they suffer from a low grade of the disease. That is, for each person with known diabetes, there is someone who does not know he has it. And also, in addition to that, 40% of the obese people suffer from diabetes, but do not know about it. And that is why it is very important to go for checkups, maybe yearly or 6 monthly checkups is very, very important. Blood pressure, your sugar, and so on. Diabetes in an industrialized country is the second cause of blindness, the third cause of renal failure, and it's responsible for half the amputation of lower limbs and one of the primary causes of death. Diabetes has been known from time immemorial. However, it is mentioned for the first time in the 1st century by the philosopher and Greek physician Arateus of Cappadocia, who uses the word diabetes, which means to run through, like the disease that eliminates great quantities of urine. In the middle of the 19th century, the famous Claude Bernard made known his research on the metabolism of carbohydrates. And this research led to the first guidelines being given for the norms of diabetic treatment. And based on the restriction of carbohydrates and in the low caloric value of diet. At the same time, the influence of obesity and sedentary life on the origin of diabetes would also be revealed. In 1922, Frederick Banting, a physician and professor at the University of Toronto in Canada, and his assistant, Charles Best, Charles was a student at that university at that time. So they made a research for the treatment of diabetes. And they made their research on the dogs, using the dog. And the discovery, they actually took out the pancreas from the dog. And by doing that, they discovered that the insulin was actually produced in the pancreas. The medical term diabetes mellitus is actually a Latin term. Like most of the terms in medicine, they are Latin, mostly Latin terms. It refers to the situation, to the sweetness of the urine, like honey, the urine that is sweet like honey, mellitus, of the people with diabetes. It is a chronic metabolic disorder characterized by persistently high levels of glucose in the blood. This is due to the fact that the body is not producing sufficient insulin or does not use it adequately. In both cases, diabetes does not allow the body to metabolize effectively the use of carbohydrates, as well as proteins and fats. The cells in the body need glucose to live, sugar. They need sugar to live. In order to meet this need, we eat food, especially carbohydrates, that is changed into sugar. However, the glucose cannot penetrate the cells without the intervention of insulin. So insulin acts as a key to open those cells for the sugar to enter into the cells to be used by the cells and provide energy. Now, insulin is a hormone that is produced in the beta cell of the pancreas. The presence of glucose in the bloodstream stimulates it stimulates the beta cells to produce insulin. And now I will talk about the types of diabetes now. We have two main types of diabetes. We have the insulin dependent or juvenile diabetes. It is actually named so because it mostly affects young, children and young adults, the juvenile part. And this is due to the fact that the body produces little or no insulin. In this case, the usage, the insulin cannot penetrate into the cells to be used because probably it's very small, it's produced in very small quantity, or no insulin at all. So it cannot, the sugar cannot really penetrate into the cells like I explained a bit earlier. The causes of this type of diabetes, I did mention that it usually affects the young children and adults, but of course, it can also affect adults as well. When it affects the young people, it's sudden, but with in the older ages, it goes slowly. Now, these the causes of this type There is also the autoimmune aspect of this diabetes type 1. That means the autoimmune aspect is that the cells of the body do not recognize the beta cells in the pancreas as part of the body. You know, they treat them as foreign bodies, and they attack them and destroy them. And that's why we call it autoimmune. They attack and destroy them. So they actually, the immune system erroneously considers that these cells are not part of the body, and whatever is not part of the body, the immune system tries to destroy. The second type of diabetes, we call it diabetes, diabetes type 2 diabetes. The body produces, in this type, the body produces insulin. However, it does not produce it in sufficient quantity, or the cells of the body do not permit entrance of glucose into them. And they are risks of developing this type of diabetes. And those risks increase with age. As we grow older, we are at risk of developing it. Also, the weight, the more obese a person is, they are at risk of developing it. And also a sedentary type of life. People who do not do exercise, they are also at risk. It is more frequent in women with a history of gestational diabetes. We get also women that only develop diabetes when they are pregnant. And this is especially, it happens most of the time in women that give birth to bigger children. Babies that are more than 4 kilograms, they are prone to develop this type of diabetes, type 2 diabetes. It also, people that have high blood pressure or even elevated cholesterol or triglycerides, they also are at risk of developing this kind of diabetes. And also there are also hereditary, hereditary risks, a family of diabetics or genetic disease. There are people that, are just having it's found in the family. We have mentioned about obesity or overweight, a BMI higher than 27. There is, has been identified as a risk factor. And of course now the pregnant ladies that I said, especially those who are predisposed to this kind of diabetes, particularly in their second half of pregnancy. Sometimes this type of diabetes that comes with pregnancy or gestational diabetes, it disappears after delivery. But more than half of the women who have that end up actually having type 2 diabetes. But not only type 2, they can also have type 1 diabetes, but in much less frequency. Type 2 diabetes people can actually do with oral agents, oral medications. But type 1, usually it's insulin, like the word goes, insulin dependent. They need to inject themselves. I have mentioned that physical inactivity, people who are sedentary, they live a sedentary life, they do not do exercises, they are really prone to have this type of diabetes, and of course the age as well. As we grow older, we are at risk of not only diabetes, but of many other diseases like high blood pressure, heart diseases, and so on. There are also some medications that can increase the level of glucose in the blood or impede the functions of insulin. They impede it, the insulin from acting in an appropriate way. And so taking some of these medications that I'll mention here can also increase the risk of getting diabetes. Those are anti-inflammatory steroids, like your prednisone or dexamethasone, etc. The diuretics, those are medications that are usually used to eliminate excess fluids from the body. Sometimes we use them in high blood pressure, or probably in people with cardiac failure. They also use this. It predisposes someone to the risk also of getting diabetes. Some antihypertensive medications, like some of the beta blockers, like your propranolol or the dioxazide, they also predispose to the risk of getting diabetes. Some immunosuppressants are usually used to prevent rejections of transplants. For example, if a person has had a transplant of the kidney or the liver or the heart, they use these immunosuppressants like cyclosporin and so on. So those also predispose one to the risk of getting diabetes. The damage to the pancreas, when the pancreas is damaged, perhaps you get, like in the case of pancreatitis, you get people that drink a lot of alcohol and they end up with pancreatitis, or any inflammatory process of the pancreas. You get also some cancers of the pancreas. If they affect the beta cells, of course, then there will be an impairment, or the insulin will not be secreted properly, and the person ends up having diabetes. Hemochromatosis is a condition whereby you have excessive accumulation of iron in the body, and damage, and this damages actually the pancreatic cells, including the beta cells where the insulin is produced. Also, surgical removal of the pancreas. If someone gets an operation and the pancreas is removed for some reasons, maybe cancer or any other reasons, then they are predisposed to having diabetes, because they will no longer be able to produce the insulin that is needed to help with the absorption of the glucose into the cells. Some hormonal changes also predisposes us to the risk of getting diabetes. Like in those that have got Cushing syndrome, in which the adrenal glands produce too much steroid hormones, and acromegaly, in which the pituitary gland produces an excess of the growth hormone. These hormones, they oppose the action of insulin and increase the risk of having diabetes mellitus type 2. Some viral infections also suffered up to 2 years before can actually destroy the beta cells of the pancreas and predisposes one to getting this kind of diabetes. Now, what are the symptoms? I think most of us, we know who have lived with people with diabetes in our homes, we might have noticed those symptoms. There is urine frequency, or polyuria as we put it. There is the need to urinate in great quantities. The person keeps on going to the toilet many times because the kidneys is trying to filter excess glucose in order to eliminate and the glucose from the body or from the bloodstream. So it tries to to do that, and then so the person urinates many times. However, also glucose is an osmotic diuretic, and it takes with it a lot of water and of course and salt in great quantity. And by doing that, this process produces cellular dehydration, and so a person feels thirsty most of the time. So then we have also increased polydipsia, or people keep on drinking many times because of what I have just explained now. Sugar is an osmotic diuretic, and it takes with it great quantities of water. And so by taking great quantity, the person feels dehydrated, and they are, they have to drink. They even get up in the night sometimes to go and drink, and so on. There is also polyphagia, that is increased hunger, and it is because glucose is lost in excess through urine. An individual also feels weak and tired all the time. So it's very difficult for them to carry out their daily work activities, as indicated by the fact that they rest and sleep, more than normal, and as they did not do before they started with the symptoms of diabetes. They also lose weight. Weight loss is one of those. In spite the fact that they have increased appetite, and even if the individual eats more, he continues to lose weight, because the cells of the body cannot utilize the glucose. So they begin to get the energy from the fats reserves. I think those have done biology, you probably remember the Krebs cycle. Yeah, and so they try to get their energy from the fats that are actually stored up in the body, those reserves. So the individual loses weight. In diabetes number 1, the weight loss is really quite rapid. But in diabetes type 2, it is not that, not that frequent, and it happens at a slow rate. People with diabetes also have slow healing of their wounds, cuts. If they get cut or bruises, they heal very, very slow. They may have tingling or numbness of the feet and hands. They may have reddening or swelling of and sensitive gums. There are gums, what we call gingivitis, swelling and sensitive. They bleed easily. They can have repetitive infections of the skin, of the gums, mouth, of the urinary tract infection, and of course, genital infections as well. Some of them that have not been checked on time, they also can have blurred vision. They have blurred vision because when the quantity of glucose in the blood is high, the lens of the eye absorbs it, the glucose and water, and then so it gets inflamed. And this inflammation causes the eye to just see blurred, it can't see properly. They can also be irritable. They can be irritable. The complications of diabetes are hypoglycemia. If a person overuses insulin, for those that are injecting themselves and do not respect the doses that have been prescribed for them, the sugar level can go down. Or perhaps they delay in consuming food. And that is why it is very important that people with diabetes should really have hours whereby they consume their food, or perhaps inadequate consumption of their food. Sometimes also when they exercise intensively, the sugar level goes down. Or those that consume, excessive alcohol. Alcohol also makes the sugar to go down. When this happens, a person should try to take a fruit or something, to just get it elevated. There are also long-term complications of diabetes, and those are cardiovascular complications, like developing coronary or cerebrovascular complications due to the effects that sugar has on the arteries. And we have mentioned about those amputations. People also get amputations because of the effects of that, the fact that it doesn't heal on time. There's also peripheral arteriopathy and intermittent cramps in the legs and sensory neuropathy, because the nerves are also affected. I have a lot to share with you on this, but I think my time is really getting up. And what I would just briefly say is that it's very important to really take the health message holistically. The diet, that will be a topic for another day, because I think my time is up now. But I would say the diet that we know as Seventh-day Adventists, eating lots of vegetables and legumes and less of the carbohydrates, like your whole grain you eat, but in less quantities, and the tubers and so on. So exercise, drink lots of water, the health message that we know, do all these things to avoid having, prevention is better than cure, and do these things. And, be hopeful, be grateful, have hope, help others. All these things, they contribute to you, feeling well and decreasing the stress that puts you at risk of getting diabetes. And 3 John verse 2 says, "Beloved, I pray that you may prosper in all things and be in health, just like your soul prospers." And Sister Ellen G. White also says, faith is trusting God, believing, and believing that He loves us and knows best what is for our good. That is from education page 253. I thank you.
I hear the voice of Jesus calling. My answer is, I will go. I see the need of people crying. My answer is, I will go. I go to share the message of love. I go to share the blessed hope. But if I get discouraged, I call to Jesus' help, because I have decided I will go.
It may not be on the mountainside or over the stormy sea. It may not be at the battle's front. My Lord will have need of me. But if by a still small voice He calls to paths I do not know, I'll answer, dear Lord, with my hand in thine. I'll go where you want me to go. I'll go where you want me to go, dear Lord, or mountain or plain or sea. I'll say what you want me to say, dear Lord. I'll be what you want me to be. Perhaps today there are loving words which Jesus would have me speak. There may be now in the past of sin some wonder whom I should seek. O Savior, if thou wilt be my guide, though dark and rugged the way, my voice shall echo the message sweet. I'll say what you want me to say. I'll go where you want me to go, dear Lord, or mountain or plain or sea. I'll say what you want me to say, dear Lord. I'll be what you want me to be. day. For Jesus the crucified, so trusting my all unto thy care, I know thou lovest me. I'll do thy will with a heart sincere. I'll be what you want me to be. I'll go where you want me to go, dear Lord, or mountain or plain or sea. I'll say what you want me to say, dear Lord. I'll be what you want me to be.
Okay, thanks everyone. We don't have to leave the platform. Our next program that will start now is the education. Good morning, Eda Frank. Let me just unmute you, just a minute. Yeah.
Good morning. How are you?
I'm fine, sir.